Hello everyone, I'm Dr. Cheong, and with me here is Datuk Dr. Hatta. Hello Dr. Hatta.
Hi, Dr. Chong. How are you?
I'm
How's
fine.
everybody?
As we speak, I think the whole of Sabah is still in the middle of a tough fight with COVID-19. And a lot of us, by doing our part, are staying at home right now. And we from SabahCare would like to keep you company in these challenging times. And we would also like to take this opportunity to share with you some medical information, which we hope some of you may find useful. So we'll be doing a series of short talks on common gynecological diseases related to infertility. So today, we will start off with the first topic, which is PCOS, which stands for Polycystic Ovarian Syndrome, 或者是多囊性卵巢. So Dr. Hatta, please explain to us what is PCOS and how to diagnose it.
PCOS, thank you, Dr. Chong. PCOS means Polycystic Ovarian Syndrome. It is a condition that may affect up to 20 to 25% of women. It is whereby you have a lot of follicles. Follicles are actually small sacs that is in your ovary, which has the egg in it. So you may have a lot of these follicles in the ovary. Unfortunately, these follicles do not achieve what we call maturity. Therefore, it doesn't hatches out. The egg does not released out from the follicles. So what happens is, if we were to scan the patient transvaginally, you'll find that there's a lot of follicles around the uterus. Around the ovary, and this gives an appearance of cyst. But actually, it's not a cyst. It looks like a cyst. Since it's a lot in number, that's why we call it polycystic. And because of it appears in the ovary, that's why it is called polycystic ovary. Yeah.
And apart from the ultrasound scan, any other ways to diagnose this condition?
Apart from ultrasound scan, this condition is also associated with other factors, which is a condition which includes the level of male hormones or testosterone hormones in the patient is relatively higher than normal women. But it does not mean that you turn to be a man. No, it's just that you may have appearance of high increase of a male hormone in the lady, which may be associated with things like pimples at the face, maybe facial hair, especially at the chin or the cheek, and sometimes distribution of male pattern hair around the body. Yeah? So this is one of the condition that you may have.
Okay, so those are the symptoms and signs to watch out for. Next, I will continue by explaining to you how PCOS can cause infertility and how do we help women to get pregnant. As you mentioned just now, Dr. Hatta, in PCOS, there are a lot of multiple small follicles developing in the ovary, but these follicles are the stubborn ones. They refuse to grow and the eggs are not being released, which means there is no ovulation. When there's no ovulation, the woman can't get pregnant. So this is the reason why it can cause infertility. And it also explains why most of these ladies also have infrequent periods, which means the period comes every 4 months, 6 months, or even once a year, because when there is no ovulation, there is no period. How do we treat them? Very simple, because the problem is no ovulation, so we'll help them to ovulate. And the good news is PCOS ladies are among the best groups of patients to treat which means if we can manage to make them ovulate, they can get pregnant quite easily. And some lucky patients may even get pregnant after their first attempt. So it's quite easy to treat them. And how do we treat them? Some of you may have heard of the name Clomiphene or Clomid, which is a common ovulatory drug we use, which is taken orally. But for my patients with PCOS, we usually find that oral form alone may not be strong enough. So we usually use a combination of oral methods and injections. And this works very well. Like I say, if we manage to get them ovulate, and some of them can get pregnant quite easily. And another piece of advice I usually give to my patients is, apart from using this ovulatory medicine, how to further improve their chance of success. One is exercise to maintain a normal weight. And the other thing is, I also use this medicine called metformin quite a lot, which will help to improve the response to our ovulatory drugs. So, in other words, PCOS ladies can get pregnant quite easily, but with the correct, suitable treatment. Do you have anything to add, Dr. Hatta?
Does the majority of patients with PCOS are usually obese as well?
I would say majority of them, but not all. So if they are lucky slim patients, of course, the weight issue is not a big concern. But those who are overweight, definitely by losing weight can help to improve their chance of success. So that is one thing they must, disciplinary doing it.
So losing weight with a regular exercise and a proper diet may actually help improve this condition, if I'm not mistaken.
Yes. Yeah.
Okay. So this kind of patient, usually they can go for IVF.
Of course they can. Yeah. But usually, especially if they don't have other factors causing their infertility, I will still start out with the simple treatment, which is ovulation induction. Like I say, some get pregnant with just this simple method without having to try more advanced treatment like IVF and the rest.
Yes.
Okay.
Okay.
So anything else to add before we end?
I know I got nothing else. But like you said, for those patients who are obese with PCOS, actually there are studies to show that if you can reduce your weight by 10%, it can help you to ovulate back to normal, and you may get pregnant on your own without any help of medication. However, if the ovulation is a problem, please come and see your fertility specialist, and we may be able to help you to ovulate and to see other factors which may contribute to your inability to get pregnant. Okay.
All right, good. So I think we'll end our talk here. Thank you very much for joining. We will see you very soon in our next session when we'll be talking to you about endometriosis or 子宫内膜异位症. So meanwhile, please stay safe and stay healthy. Bye for now, everyone.
Bye. Follow the SOP. Bye.